The cost side for patients is whether insurance will still cover the vaccine. What I think the policy misses is that one reason people get vaccinated is not to protect themselves, but to protect other people and other family members.
You might face a curveball if you're planning to get the updated COVID-19 vaccine for a trip or for work. The FDA approved the vaccine prescription as free only for anyone 65 and older and people with certain medical conditions. Arman Rahman spoke with a local pharmacist and UW-Madison expert who say the sudden new guidelines have some scrambling.
Smaller independent pharmacists like the ones at Fitchburg Family Pharmacy tell me the new updated COVID-19 restrictions and guidelines have put them in a bit of a bind.
You know, there's lots of confusion.
The FDA authorized a vaccine for those at higher risk, anyone 65 and older or who has these conditions, which include asthma, cancer, dementia, or heart conditions. Anyone on that list can go to a pharmacy and get a shot just like before. Anyone not on that list would need a prescription from their doctor.
And it's totally caught everyone off guard.
According to Thad Schumacher, the owner of Fitchburg Family Pharmacy, the new vaccine guidelines still haven't been approved by the CDC's panel on immunizations, which is required for Wisconsin pharmacies to administer without a prescription.
We have a very limited supply at this point.
The panel meets later in September, but recently HHS Secretary Robert F. Kennedy Jr. fired all members and replaced some with vaccine skeptics.
Yes, I think that one solution to this problem would be for the state of Wisconsin to put out a standing order that would specify who could get the COVID vaccine.
The cost side for patients is whether insurance will still cover the vaccine.
Dan Sachs is an associate professor of risk and insurance at UW-Madison. He says if the panel approves the vaccine, it would trigger insurance plans to cover it.
And so the pharmacies know that more people are going to be able to get the vaccines at no cost to them. And of course, they're going to be much happier stocking it, more confident that they won't have excess inventory.
But right now, the list of conditions means each insurance company can choose what they do and don't want to cover. People who would get the shot in the arm might not if it costs them an arm and a leg, when vaccination rates in Wisconsin are not very high as it is.
What I think the policy misses is that one reason people get vaccinated is not to protect themselves, but to protect other people and other family members.
In the meantime, Schumacher says to contact your doctor with any questions, and he asks his future patients for patience.
Just give some grace to the pharmacists and providers across the state.
Arman Rahman, Fox 47 News at 9.
That panel meets on September 18th.